is going to be the first of your skills videos. I'm trying to make these as straightforward, exactly what you need to do for your skills, so that you'll be able to go into the lab and pass them right away, right? Because we want everybody to get through there. We want you to get through there in a timely manner, yet we still want to make sure that you kind of have the basic idea of what we're trying to do. So if you have the basic idea of what we're trying to do, then that's all we can really hope in the lab. You're not going to master skills in our nursing lab. What you'll do is you'll become familiar with what these skills are, and hopefully why we do things in certain ways. There will be a quiz before each skill. You have to take that quiz. You have to pass that quiz before you're allowed to do the skill. And what the quiz is it's just going to be over things that I'm talking about here, so that you will have an idea why we do what we do. It just got to show that you kind of have the basic idea. And for instance, right now, I'm going to get going on our gloving. That's our first skill. It's donning sterile gloves. Donning means putting on. So putting on sterile gloves, and you have to do it in a certain way because you don't want, right? In other words, you can't put your sterile gloves on and pick your nose, right? Common sense. Can't have boogers on your gloves. So if they're going to be sterile, you got to put them on in a way that will keep them sterile. But with that being said, I really need to point at something out. You got some gloves in your book, in your bag. They're in a box like this. Are these sterile gloves? Right. These are hanging in every nursing, every care room that you're in. Whether you're in the emergency room, up in med surg, and right, they always have these hanging in the room. Right? The nurse walks in, should wash their hands, grab one of these. Right next to them, they usually have the hand sanitizer. So you'll walk in, you'll wash your hands, or you'll use the hand sanitizer, then you'll put the gloves on, and you'll go about doing whatever it is that you have to do. These are not sterile gloves, right? These guys here are plain gloves, and their main purpose is to form a barrier, right? They are a barrier between you and the patient. You touch the patient with your bare hands, you get every germ that is on that patient gets on your hands, and that's what you don't want. So this here protects you, right? And consequently, it protects the patient, because what happens if I go in, I'm taking care of a patient here who has a strep infection, or let's make this good. He has one of those flesh-eating bacteria, right? You go in there and you get that on your hands because you didn't wear your gloves. Well, it's going to hurt you, and it's going to hurt every patient that you go to after that. You spread it to them, right? So that's why we wash our hands, we put this on, we take care of the patient, we take these off in a certain way, and then we wash our hands again before we leave the room. That's just the way it's done. It's the way it's got to be done. If it's not done that way, everybody in the hospital is going to have everything that everybody else in the hospital has, and that wouldn't be a good situation. Now, there's certain that after explaining to here what these are the guys that you see in every room. These are the guys that nurses put on over and over and over and over again, right? On and off, all day long. But this is a sterile glove. I believe you've got these in your kit too, because you have to, should, because you got to practice putting it on. So your red bag should have these in there. Now there's a big difference. If you notice this here now, where they manufacture these, they'll sterilize these gloves as they're coming off the line, and they throw them all in these boxes. But But then these boxes are not sealed. They're not perfectly sealed, right? So germs can get in and out of them. They're open. I stick my hand in there. The next nurse comes in, sticks her hand in there. Now, granted, we did hand hygiene before, or should have done hand hygiene before we stuck our hand in there. Yet, we still are sticking our hands in there, pulling the gloves out, right? Community. right? The community is sticking their hands in and out of, putting their hands in and out of this box. So there's no way that they stay sterile. Might start out sterile in the factory, but they don't stay that way. By the time they get to the hospital, they're no longer sterile. Believe me, they're clean, but they're not sterile. Sterile means that all the germs have been killed, right? Everything on that surface has been killed. That means you have a sterile surface, right? There's no bacteria, no fungus, no viruses, no anything. There's nothing good or bad on it. It's all dead. Clean means it's clean. The worst stuff and the really harmful stuff is not on there, but there still can be some bacteria. In fact, we have normal flora, which consists of different yeasts and bacteria all over, and completely covers our body on the outside and all through our mouth, all the way down through to our anus. We have this flora, so we got all kinds of bugs on us. This here, you'll notice this is sealed, right? These come in individually packed, sealed, so you don't have the community reaching in and out and grabbing them, right? So each one is airtight sealed. It's sterilized, it's packaged in a specific way, and then it's sealed. And I'll show you how you end up going about putting those on. Another thing is when you see sterile technique. And you're talking about like when you're putting on gowns and stuff for the OR, they're very specific on how they go about putting these things on, right? What we're talking about, but what you're going to be doing for skill is you're going to be putting on a gown for the purpose of a barrier, right? And when you go into an isolation, it's because this person has some disease that has different isolation problems, and we will get into that, the different types of isolation. But right now, I think we're going to go ahead, and I'm going to go ahead and show you how to go about putting on a pair of sterile gloves. Okay, so something that you got to know is, of course, the difference when you need to wear clean gloves, when you need to wear sterile gloves. Clean gloves every time you enter a patient's room, right? Maybe if you're going to walk in there and just ask them what they want for breakfast or anything, but anytime you're going to touch anything in a patient's room, you need to do hand hygiene, put on clean gloves, and then take the gloves off and wash your hands again before you leave the room. Every time in a room, every time you're going to touch a patient, every time you're at a patient's bedside, every time you're going to touch the patient, you're going to touch the patient's stuff, any of that. So, like I said, long story short, just anytime you enter a room. Now, when you start an IV, you look in your fundamentals book on page 467. It's got on there things that you need for sterile gloves. Let me kind of read this to you here. Use surgical asepsis for situations, for the following situations: during procedures that require intentional perforations of the skin. So anytime that you're going to be doing anything like if you're going to be cutting and lacerating, like when the doctor's removing a lump or something like that, of course he's going to wear sterile gloves. But it does have on here anytime you're puncturing, and it mentions in there when you're starting an IV. Now, when you're doing a central line, yeah, they'll be using sterile gloves. But when you are starting a peripheral line, you do not wear sterile gloves. You do use sterile technique, though. You use clean gloves. And when we go over starting IVs, I will show you exactly how that's done. You're just things that you don't touch anything that's going to enter the patient, right? You don't touch anything that's going to touch anything that's going to enter the patient. So, and there's a certain way of cleaning, certain way of doing that. But quite frankly, if you had to put on a sterile glove every time, that would take an awful lot of time, and it would cost an awful lot of money because you're starting IVs all the time. So there is a sterile technique that you can use without using the sterile gloves. So when you start an IV, you will use clean gloves. Sterile gloves, though, if you're doing a sterile dressing change, the same thing, though. It depends on what kind of a dressing change you're doing, what level of sterility you're going to need. If you can do it, there are very often times that you can do a sterile technique with clean gloves, as long as you put down the clean gloves and you do it in a way that you don't touch anything that's going to touch the area that you're keeping sterile. And that's general septic technique that you're going to be using anyway. And so anytime you're going to want sterile gloves, anytime that you're touching anything where the skin has been compromised. The skin is your first barrier against infection. If it has been compromised, in other words, there's been trauma, there's been a bad burn to the skin, anything like that, where you've lost that protective barrier of skin, you need to wear gloves, right? So you're dealing with a big cut, you're dealing with a big burn, you gotta put gloves on. Anytime you do a central line dressing change. Central lines, what they are is they are an IV. We know IVs that you stick in the finger, right? Or it's not in the finger, you stick in the hand, right? Stick it here in the forearm and put it right in here, right? You could use IVs in all of these different areas. But a central line means that you're putting the IV in one of the central areas here, right? You're going into the subclavian vein, and usually the tip of the central line will be just there above the right atrium of the heart, right? That's the superior vena cava. Might be the inferior if you're doing it down below, but usually most of them are started up in here, and they'll go down to this, and the tip of the IV will be in the superior vena cava. You do not want to get that infected, right? You don't want any IV to infect it, but that one there is just dumping right into your central system. You get an infection in there, it goes systemic right away because it gets into your entire system. And when we learn about sepsis, you'll learn why that is such a big deal. Strict sterile technique is used when you change a central line. Most of them are right here. I keep touching this, but on the video it kind of like switches it around, so it's usually right up in here. Could be either side though. So you got this you got this portacath here. A lot of them are under the skin now. We'll go over what those are, but so when you get this central line in here, anytime that you're removing the dressing and you're going to deal with it, you have to follow an aseptic technique, and there's a certain specific way to go about doing that so you don't contaminate the person. So dressing changes, when the skin has been compromised, you're going to use sterile gloves. Central dressing changes, central line dressing changes, you're going to use sterile gloves. Invasive procedures, when you are invasive in a body cavity, usually you'll use sterile gloves. For instance, when you are doing a urinary catheter, which you'll be doing as one of your skills, and you're going to have to follow a sterile technique while you do that procedure. It comes up in a couple of weeks, maybe next week, I'm not sure, but you'll be doing that soon. So now we've talked about donning your sterile gloves, and I'm also going to talk about putting on gowns, right? Sterile gowns, sterile gown or just isolation gowns. So there's different levels of gowns too. Now a sterile gown that you will use like over in the OR, you have to put on a specific way, and you have to keep it sterile the entire time. When you're the gowns that you'll be dealing with most of the time are isolation gowns. You don't want to get any, you don't want to carry any germs that you might have on your uniform. And that's the big thing about gowns. You don't want to be carrying anything that you might have in your uniform. And believe me, your uniforms get contaminated. You change your bedding and stuff, and you're carrying linen in and out. You try to hold them away from your body. That's one thing. You never hug your linen, right? You don't take the linen and hug it up next to you and carry it on out there and throw it away. No, you take your linen and you hold it away from your body, and you go like that, because you're trying to keep your gown or your scrubs as clean as you can possibly keep them. That being said, they're going to be contaminated. You consider them contaminated. So you will see the isolation. It is on page 467, I believe, infection prevention control. Let's see. I think here in your book. And so the different kinds of isolation that we have, takes different types of equipment and different levels of isolation and different levels of barrier that are required, and just depends on what kind of infection the person has. Uh, we have contact isolation, we have droplet precaution isolation, we have airborne isolation, and we have a protective isolation. So contact precautions, that means direct body fluids. This is somebody who has an infection. HIV is a contact thing, so it's and it takes direct contact with body fluids. Direct contact means that you come in direct contact with the body fluids, right? Um, for instance, you've got the blood on your hands. There was, back when HIV first came out, there was a nurse in the emergency room that somebody had been brought in, and the person was spurting blood. So before she could get a glove on, she put her hand down over that, applied pressure until somebody who was gloved came over, took over. She went, washed her hands, and then put her gloves on, but it was too late. She ended up HIV positive. She went around the country doing a lot of speeches and talks about that happening to her. Indirect contact means that it comes from a person's body fluids. This comes from that, but it can be transferred indirectly. This is what we're trying to prevent a lot of times with our gloving, because we prevent the direct contact, obviously, but then the indirect contact would be us getting our hands dirty and then walking into the next patient and then touching them. So they didn't come in direct contact with this other patient's bodily fluids, but they did through me, right? There was an intermediate thing there. Can also be contaminated instruments. There was a story years ago about a dentist who was doing some kind of work, and he wasn't cleaning his instruments between people, and he was given from one person to the other, spreading disease. But so that's contact precautions. Contact precautions, you need gloves and gown, right? And you need to glove and gown whenever you're going to be coming in contact with a person on contact precautions. Now another one is droplet precautions. And droplets is large droplets, right? These droplet precaution means that that's the larger drop when they cough, and the little things that their book has in there. It's like, at least I think, what is it, 5 microns or something, whatever that is. I don't know how big that is, but it's the larger droplets, and they say that you should be protected when you're going to be within 3 feet of these people. Usually, when on entering the room with somebody with droplet precautions, you will go ahead and wear a surgical mask, and of course use proper hand hygiene. It's also, if droplet precautions usually isn't going to be spread like on your uniform, but a gown is not a bad idea. But what's required is a surgical mask, especially if you're going to be within 3 feet of this person. Good hand hygiene. Good hand hygiene on all of these, by the way. Airborne. Now, for droplet precautions, right? That's influenza is a good example of droplet precautions. But airborne precautions would be like tuberculosis, TB, or something like that. Very small, fine things, and they get aerosolized, especially if you're using a nebulizer with this person. It gets aerosolized, and these little drops just hang in the air, right? And they hang all over in the air. And so they can cause a lot. They can cause a lot more problems, because it doesn't take the droplet going from one person directly to the other person like influenza. This one here hangs around in the air, right? So anybody in that room needs to be protected. And the big thing about somebody who's an airborne is you're going to wear not just a mask, you're going to wear the N95 respirator, or they've got a different one out now, and I'm not sure what the other one is called. The N95 had to be sealed. I couldn't wear one because I had a beard, um, a certain percentage of people, so I have to have have to be able to seal one of these masks. So I was one of the ones who couldn't, unless I shaved off my. And they're in a negative pressure room. People on airborne precautions. Tuberculosis is the big one. It's one that I think of. TB. When you get somebody who's positive for TB, you put them in a negative pressure room, and the only people that can go in the room are people with this respirator on. It's not one of these things where you step in the door and you put the you put this thing on before you enter the room. And the room has got a negative pressure, which means that air will not puff out of the room. When you open up the door, when you do things like that, air will close. In fact, if you kind of open the door, in the ER we had someone, if you'd open the door, it would just slam that door shut again, right? If you open it out, it would slam it back shut because it sucks air into the room and up through this HEPA filter. And by sucking the air into the room, you don't get these droplets that fill up the room. When you open the door, you don't have the air going out into the hallway. So somebody walking by the room and the door happens to open at the same time, they aren't going to get a big puff of tuberculosis in the air. So it stays in the room. It gets sucked in and through a HEPA filter before it's blown out, wherever they blow it to. I don't know, but they don't blow it into the regular system. It's separated from the rest of the system in the hospital. Then you have protective isolation. These are people who have no immunity. Now, normally there's different levels of protective isolation. We always are going to protect people to a certain extent, but sometimes when you have a person who has no immune system, maybe they're doing stem cell research. That's a great example. It's the example, I think it was in your book, the Perry Potter Fundamentals book. But by having a positive, now we were talking in the airborne isolation, they had a negative. Now in this protective isolation, they'll have a positive airflow. And that means that air is blown into the room, so it's got a positive pressure, so it leaks out. Because what you're trying to do is you're trying to protect the patient who's inside. So that way germs and stuff going down the hallway, when the air opens up, it isn't going to go flowing into the room because positive pressure is going to blow out. So the air, so germs won't get sucked into the room at all. When you open up a door, things come outwards. So you're just controlling the flow of the air in both of these isolations. Protective isolation is not really the one that's used the most. We think of contact, droplet, and airborne, but protective isolation is to protect the patient. So that's that.